Welcome to Mahaska Health Medical Minute, where we will talk with your local trusted experts to bring important healthcare topics for you, your family, and our community. Thanks for joining us today. You are listening to Mahaska Health Medical Minute. My name is Renee Edgar, registered nurse here at Mahaska Health, and I'll be your host for this episode. Today, talking about healthy living is Dr. Mark Zahadias. And we clarified that last week with your brother, Dr. Z. So we'll kindly refer to Dr. Z if you don't mind today.
Yep.
He's a primary care provider here at Mahaska Health. He comes to us with so much knowledge when talking about healthy living. He's passionate about helping patients and their families through each stage of their life. Today, what we'll look at and talk to him about is a typical day that he experiences here at Mahaska Health. Share with us what your position here is in the community.
Yeah.
And what your typical day would look like here.
So I'm the classic outpatient family doc. I see newborns and up, and that's majority of my days. I spend in coming early, coming into the clinic. We do a lot of patient visits, and then at the end of the day, just kind of wrapping up things with labs, patient messages, stuff like that. I usually make it out to the hospice where I serve as the hospice director on Tuesdays and Sundays. But other than that, it's just Monday through Friday clinic.
You make it sound pretty simple.
Yeah, it is.
So tell us a little bit. You have a brother that lives here.
Yep.
Wife is here. Tell us a little bit about your background.
So originally from Chicago, born and raised in Naperville with my older brother. But both our parents are Polish, from Poland. So that's where we get the last name. Okay. I made it out to St. Louis for medical school and then residency. And that's been about 3 years ago for the last 7 years. So I spent a majority of my adult life in St. Louis, and then met my wife, and then we decided to move up to Iowa. She's originally from Jefferson, so
okay, wonderful.
It was nice to be close to family, and yeah.
Do they make it up here very often, or do you travel very often?
Yeah,
good.
Yeah. It's 2 hours away, and she has plenty of family in Des Moines, so it's easy hour drive.
Good.
Yeah, I like to be as south as we can, so it makes a difference. It's a little bit warmer.
So do you like Polish food?
No, I like barbecue. So
yeah. St. Louis.
Yeah, St. Louis.
Makes sense.
I mean, Korean barbecue is my favorite,
okay.
But then I love Great Expectations. His ribs are just unreal.
They're
some of the
really
best ones.
good.
Yeah, so yeah, anything barbecue I'm always
really
up for. So burnt ends, rib tips, that's the stuff I love.
Okay.
Yeah.
Good. Well, we're so thankful for all that you do for our community and to serve our patients here at Mahaska Health. I know many individuals absolutely love having you as their primary care provider. And feel so cared for because of your attention to detail and just the focus on listening to the patient. My cardiac patients who I see daily, it's a daily comment on
awesome.
Just the love that you portray to them on their care.
And we really do love being here. So it's such a nice community.
So tell me, as a primary care provider, what types of care do you provide and what types of conditions essentially do you treat? Yeah,
so a lot of it, when we say newborn and up, a lot of the newborn adolescent care is a lot of preventative care medicine. So it's and a lot of that's just kind of behavioral rather than truly like medical conditions, but it's making sure kiddos are growing on the right path, getting the nutrition and everything that they need, and developing into nice young healthy adults and that kind of stuff. So that's a lot of the adolescent pediatric care, and making sure they get their vaccinations and other routine things. And then once you get to adult and then young adult, you're trying to build healthy habits and being kind of independent in terms. So when you get into the adult population, it's more kind of looking at, certain behaviors and patterns that, whether they're cooking, exercising, sleeping well, that are going to be preventing any kind of issues down the road. Metabolic syndrome being the biggest one. So like diabetes, hypertension, hyperlipidemia. Then once we get into the little bit older population and into the geriatric population, it's treating a lot of more chronic medical conditions and making sure that, the quality of life is as best as we can make it, and that patient goals are, part of that discussion, and making sure people get to do the things they want to do. So,
well, surely a lot of your experiences in primary health really include individuals wanting to improve their health.
Yeah.
When a patient comes to you requesting a way to improve and optimize their health and meet their personalized goals, what does that first visit look like for a patient?
Yeah, that's a great thing. So there's 3 big domains I like to focus on: diet, exercise, and sleep. Majority something usually we neglect in one of those 3 domains, and that just becomes kind of this pattern or behavior that over months and years leads to, high blood pressure, other kind of health issues and conditions. And then if you go back even one step further, it's stress. So stress is just such a big thing that plays in everybody's life, whether it's work, home life, social situations, that kind of stuff. But how do we deal with stress? How do we let stress affect us? So there's a couple of things I like to harp on, but one of the biggest ones is the mindfulness-based stress reduction. Dr. Kabat-Zinn has a lot of great books, a lot of YouTube video stuff that you can just look up and start. But it's amazing how much 10 minutes of just mindfulness a day can help reduce the stress, help lead to better eating habits, better sleep habits, better exercise routines, stuff like that can make huge differences in patients in terms of their wellness and health long term.
Success stories. What looking back, what's been your biggest success story?
There's a couple. I love weight loss. Because it spirals and it helps people. There's kind of this positive spiral of when they get on the right diet plan, they get right into exercise, they start feeling and sleeping better. Medications can or cannot be a part of that, but that's by far my most rewarding is patients that are able to make those life changes sustainably, making these little things that, they incorporate day to day that will help long term, and getting patients off of medications. That's probably the most rewarding thing. Like for diabetes, get under control, blood pressures get under control, and even to the point where their blood sugars are normal, we can start backing off medications. And yeah, it becomes kind of this nice positive spiral, and seeing that maintained is awesome.
It's so great to hear patients' success stories, and it's when a patient really feels that they are succeeding and you've helped with that process. It's just a feeling you just can't replicate.
Yeah.
And it's great. In the clinic, you have a wonderful sidekick, Jen. What a rock star to work with you day to day in clinic. And
she's fantastic.
Right. She was giving me a story the other day about your walking tacos, and coming to Iowa was your first walking taco experience.
Yeah. There's a lot of things here that I've been introduced to. Handballs, loaded potatoes, walking tacos. So anytime they mention this and I have no idea what they're talking about, like, you just have to try it. And the walking tacos are like, the rest of it's not for me.
Hearing you talk about how much you love partnering with your patients is fantastic. I'm so happy you're in our community. And I'm happy that we have so many providers just like you who really want to get to know each individual patient. Thank you so much. It was great to talk to you about just general healthy living habits, and to hear about your passion for serving the needs of the whole individual and family. You truly make a difference, Dr. Z.
I appreciate it.
And we see that every day. So thank you.
Thank you. I really do appreciate it.
Mahaska Health is dedicated to caring for you. We have a team of experts putting everything they have into your health and getting you back to what matters most. Same-day appointments are available, and our walk-in is open 7 a.m. to 7 p.m. Monday through Friday, 8 a.m. to 4 p.m. Saturday and Sunday. Our telephone number is 672-3100, and feel free to visit our website, mahaskahealth.org, for up-to-date information.